Good morning, gentlemen. Brad, I'll pull up the slides. All right, here we go. So this is our biweekly update. Next slide, please. So in the national picture, we've still seen over 3 million new cases in the last 14 days and 35,000 deaths nationwide. Go to the next slide, please, for the state. Statewide, we're still at, we're now at 204,600 cases in the state. That's an additional 30,000 since 2 weeks ago. But we've also had an additional 54,000 negative tests in that same time period. Next slide. Here in the county, we are currently at 3,749 cases, over 2,200 recovered. We've got about almost 1,500 active ones, and in the last 2 weeks, we have had 13 additional deaths. In that 24 hours after our last update 2 weeks ago, we had 8 during that period, within that 24 hours. And then, thankfully, though, the number of deaths has tapered off since then. I will be happy when we can be able to report again that, we have had no new deaths within the reporting periods. Currently, the hospital has 42 inpatient, additional from KDHE. Saline County has had so far 13,000, almost 14,000 people tested, almost 10,000 negative results, and our monthly positive rate is at 13.8, which is down from 17% that it was last time. One thing I want to say that was interesting as I was putting this together, for the last couple of updates, those 2-week increments we've seen, although the numbers of course have gone up, but we've seen a steady increase in those numbers, meaning that from that one report to the next, the amount of cases was higher than that 2 weeks before it, where it might have been 2 million in the 2-week period prior, then it was close to 3 million the next week, a little bit more, the next reporting period. In this one though, the interesting trend that seemed to kind of come out is that the 2-week increase was from the 7th until yesterday was actually a little bit lower, national, state, and countywide. Now, is that because we are, of all the increased testing and all of the increased communications that are out there and increased mask mandates? Is it because it's getting closer to Christmas and people just, don't want to be quarantined over Christmas? I'm not exactly sure, and I will have to wait, another couple of reporting periods to see if that trend stays kind of looking downward or if it goes back up or what it does. But it was just an interesting note that across the national, state, and local levels, that the totals were actually showing a little bit of a downward trend in that. So if we'll go to the next slide, please. So our cases per month, we are getting close to, we're a little over 1,200 or so this month. Fingers crossed that we don't exceed November with the holidays right now. But as we'll talk about shortly, there was a lot of testing this past weekend, and we haven't seen all the results come in from that yet. So there still remains quite a bit to be seen as far as our cases coming up here pretty soon. Next slide. Again, this month we've had more deaths due to COVID-19 than we did last month. Thankfully, that has slowed down in the last week, and hopefully that slowing trend will continue through the end of the month. Next slide. So we started breaking out the clusters by the types of places that they are. Some of these have actually been on the list for quite a while because a cluster is considered closed when we go 28 days without a new case that's related to that cluster. And so there have been at times where we might get to like day 26, 27, and then another one pops up. And so it kind of starts that clock over again. But we've also had quite a few that we have closed out. So with all of the testing that's been going on, and hopefully we can close out some more of these fairly soon. But you can see the clusters are pretty well, except for long-term care where we kind of unfortunately expect to see some, and then private business, they're pretty much spread across the gambit. And these categories are how KDHE defines the types of clusters. So I'm using their terminology so that we stay consistent amongst our discussions as far as, how many clusters there are and where they are at, or what types they are. Next slide. So I mentioned that there were several free testing events over this past weekend. Reports I have gotten from the ones that were conducted through Well Health, Salina Regional, and Salina Family, that there was about 1,400 or so tests that were conducted. Keep in mind that, these were open to anybody, so that doesn't mean that that was 1,400 Saline County residents. That could be from any county around us that came through them. But we should, results are slowly starting to trickle in from all of those. And so I expect that later on tonight or tomorrow that we'll see probably the bulk of those results coming in. From what I have gotten so far is that due to the holidays, these testing events were also being funded by the state using CRF funds. And so since those are expiring, there are currently no other large-scale free testing events planned in the short term. And then after the first of the year, we'll have to look at how we can try and logistically and then financially be able to continue something else like that without that CRF funds being able to back it up. Next slide. The thing that probably everybody wants to know about vaccines, and just keep in mind that information come out about vaccines and where and when is changing, can change and is changing often. Pfizer was out last week to the hospitals. Moderna has been approved and has started to be pushed out to local health departments for EMS, public health staff, and other healthcare workers. And as such, we'll be coordinating between ourselves, Salina Family and Salina Regional, with extra doses to help cover those workers at other healthcare entities that were not directly identified in the state's initial push, and we'll be reaching out to them to coordinate those efforts. The Moderna vaccine doesn't have to be kept ultra cold like the Pfizer one. However, it still has a few complexities. That it is kept frozen. It has to thaw at a certain rate over a certain time. Once you puncture the seal on that vial, you have to be ready to give 10 of them because it's only good for a few hours after it's thawed and punctured. So there'll be some additional coordination as we work with EMS and other healthcare providers to get other healthcare workers vaccinated that weren't previously identified in the state's plan. Next slide. And of course, this is, you may have seen this last week at one of the governor's press conferences. This is their most current draft of expected vaccine availability due to population groups. The one thing I did add is just so that everybody can see, long-term care facilities and residents, there has been coordination, and they should be receiving all of their vaccine through the National Pharmacy Program. I think I mentioned a little bit about that last week. And so they are already prepared, and I believe supposed to be getting theirs next week for those facilities. And then you can see how they have broken down other population groups. And I expect that, like many things so far, you know, this will probably change a few times as we get more information, and through our press releases and other avenues, we'll try and update the public with what information we get. Just keeping in mind that quite often local health departments are getting the information at the same time as everybody else does when the press conferences are conducted. So, next slide. So it's hard to believe with almost 60 degrees today that Christmas is this week. I know that, you know, a lot of people are still going to, you know, try and have family gatherings and things like that. But really, you know, we need your help to stop the spread. Wear your mask, social distance, wash your hands, especially avoid large groups. Just remember that there is a mass gathering restriction. And really, we just want people to, we know that, you know, they're going to have holiday. We just want them to have a safe holiday and not end up with unintentionally giving COVID to all of their families as Christmas presents. Next slide. So just a reminder that, you know, continue in the mask order because it works when everybody does their part, and that we need to continue to be vigilant and act like COVID is everywhere, because it is. One additional thing that Michelle Barkley, the emergency manager, asked me to remind or to add to this is that last week we received 15 pallets of hand sanitizer from the state. Each county was given an allotment of it. And so far we have gotten rid of 5.5 pallets. There's still 9.5 pallets. Each case has 70 bottles, and they are the 3 to 4 ounce small bottles. It is free to businesses, to residents, to anybody. The only stipulation is it cannot be sold. So if there's anybody interested in hand sanitizer for whatever, or if they just need more around their house, all they need to do is contact Michelle Barkley at Emergency Management. She's handling the logistics of the distribution on that, and then they can be able to pick that up. And with that, that's all I have today, gentlemen. So I will stand for questions if you have any.
I do have one, Jason, in regards to the vaccine. Do we have any further update as far as what Saline County is getting? I know that the hospital is pretty well taking care of their entire staff, and I had lab work done this morning, and the lady at the lab said that she'd had her shot yesterday. So I just wondered what the update is on the vaccine for Saline County.
All right, so the hospital received Pfizer last week. And so yesterday, we received at the health department 200 doses. That is for staff, for EMS, and then for those additional healthcare workers, like I mentioned earlier. The FQHC, Saline Family, received, I think it was maybe 300 or 400 doses for staff, for their staff. And then we have to work with them to make sure that all of those other smaller healthcare agencies, like other doctors' offices, specialty care that aren't part of the hospital chain, to coordinate to give their vaccine. The vaccine yesterday, quite honestly, showed up without any heads up or warning. And so, and some of the paperwork that we were expecting, at least through some of the KDHE webinars that was supposed to come with it, didn't. So we've been working to draft a consent form and a protocol that has to get signed sometime today before we can start giving that.
All right, are other commissioners have questions or comments? If not, thank you, Jason, that, it's helpful. Keep our fingers crossed and, follow the guidelines. It's, see where we can go from there.
Yes, sir. You know, information, like I said earlier, it does change very quickly, even from day to day on some of the stuff that we're told or that we learn. And so we're trying to not only keep up with those changes, but get information out to the public that's relevant to the public and not, you know, cause confusion too, as quickly as we can to make sure it's the most accurate. And so, and that is a challenge in these times too.
Okay, because this was a review of a resolution and with a possible action on the, is there a motion for this amendment, review of this amendment?
I'll move that we continue with the mask mandate.
I'll second the motion.
And I'm not sure we've even needed a motion on that part of it, but we'll do that anyway. All of those in favor of the motion that's on the table, and that is to take no action on and continue the mask mandate for Saline County. And I will ask for a roll call vote. Monty Shadwick.
Aye.
Commissioner White.
Aye.
Commissioner Sparks.
Aye.
Commissioner Weiss.
Aye.
Mr. Vidrickson is aye. That carries 5-0. Thank you, Jason, for your update, and we appreciate it very much.
Thank you, gentlemen. Merry Christmas.
Same to you.